Hello friends, we are from Group 2. We are here today to talk about diabetes mellitus. Do you know what is diabetes mellitus? I think all of you are familiar with diabetes mellitus, right? Okay, diabetes mellitus is a general term for heterogeneous disturbance of metabolism for which the main finding is chronic hyperglycemia. The cause is either impaired insulin secretion or impaired insulin action or both. There are a few different types of diabetes mellitus according to the American Diabetes Association. First, type 1 diabetes mellitus. The type 1 diabetes needs insulin to preserve life. This type of diabetes is caused by genetic and immunologic factors. Environmental factors like virus can also cause type 1 diabetes. The onset occurs at any age, but usually happens to the people under 30. Second, type 2 diabetes mellitus. The type 2 diabetes is the most common type of diabetes mellitus. 90 to 95% of all diabetes are type 2 diabetes. Obesity and lack of exercise are the factors that can induce this type of diabetes. The onset occurs at any age, but usually happens to the people over 30. Third, gestational diabetes. This type of diabetes affects pregnant women and happens due to the hormones secreted by the placenta. Those hormones can inhibit insulin action.
Next one is about symptoms of diabetes. So, as we can see in the slide, there are a lot of symptoms. There are a lot of common symptoms that can indicate of diabetes. The first one is polydipsia. Polydipsia is the term given to excessive thirst and is one of the initial symptoms of diabetes that also usually accompanied by temporary or prolonged dryness of the mouth. The second one is polyuria. Polyuria is condition where the body urinates more than usual and passes excessive or abnormally large amount of urine. And then the third one is polyphagia, or excessive hunger or increased appetite. And this one also three main signs of diabetes. Number 4 is fatigue, and then dizziness, unexplained weight loss, slow healing, and then blurred vision. And blurred vision is one of the common signs of diabetes mellitus, which refers to the loss of sharpness of vision and the inability to see fine details that can affect one eye or both eyes and can occur often or rarely. And then genital itchiness, and the last one is nausea and vomiting. And then what about diabetes effect? Diabetes can cause long-term damage to our body. The long-term damage is commonly referred to as diabetic complication. Number 1 is diabetic neuropathy. One of the most complications of diabetes is diabetic peripheral neuropathy or DPN. Moreover, not only can chronic hyperglycemic have various negative effects on the central nervous system, but it can also cause gastroparesis. And number 2 is diabetic nephropathy. This one is found in as many as 7% of type 2 diabetic patients at the time of their diabetes mellitus diagnosis. Number 3 is the eyes. Hyperglycemic has toxic effect on almost all cells in the body, but in ophthalmologic complications of hyperglycemia are most profound in the cornea and retina. Number 4 is cardiovascular, and number 5 is skin disorder, usually neglected and frequently underdiagnosed among diabetic patients, are common complications and encounter a broad spectrum of disorder in both type 1 and type 2 diabetes mellitus, for example, cutaneous infection, dry skin, and pruritus.
Okay, next, this is the risk factor of diabetes mellitus. The first is because the genetic. 40% of risk decrease relative of type 2 diabetes mellitus patient may develop diabetes. Second is the lifestyle or the habit. Lifestyle factors such as sedentary lifestyle, physical inactivity, smoking, and alcohol consumption can also develop of type 2 diabetes mellitus. The third is because the obesity. According to the World Health Organization or WHO, nearly 90% of diabetic patients develop type 2 diabetes mellitus, mostly relating to excess body weight. Furthermore, obesity is strongly inherited. The fourth is because the diet. Studies have shown that a low-fiber diet with a high glycemic index is positively associated with a higher risk of type 2 diabetes mellitus. Okay, next, the prevention of diabetes. Prevention diabetes mellitus in people who are at risk in principle is to change their lifestyle which includes exercise, weight loss, dietary adjustment, and quiet smoking. Okay, the first is exercise or doing physical activity. Physical activity must be increased by a regular exercise, at least 150 minutes a week. Exercise can improve insulin resistance that occur in pre-diabetic patients, increase HDL or good cholesterol level, and help achieve ideal body weight. Apart from exercising, it is recommended to be more active during daily activities. For example, by choosing to use stairs instead of the elevator, or walking to the market instead of using a car. The second is weight loss. Based on an analysis of a group of people with intensive lifestyle change, diabetes prevention was most closely associated with weight loss. According to the research, 5 until 10% weight loss can prevent or slow down the emergence of type 2 diabetes. The third prevention is dietary arrangement. It is also advisable to have a healthy diet, which consists of complex carbohydrates, contain little saturated fat, and is high in soluble fiber. Calorie intake is aimed at achieving ideal body weight. The last one is quiet smoking. As we all know, the smoking is a bad habit. Smoking, although it doesn't directly lead to glucose intolerance, can exacerbate the cardiovascular complication of glucose intolerance and type 2 diabetes. Therefore, patients are also advised to quiet smoking. Enough. And then this is our reference. And thanks for your attention and see you.